Hi, my name is Andrea. I'm a nurse at the UW Carbone Cancer Center. This video will show you how to disconnect your home infusion from an elastomeric bulb that contains a closed system transfer device in the tubing. The first step is washing your hands. Then gather your supplies. Put on your gloves and cover your work area with paper towels or napkins to protect the surface. Prepare your chemotainer. This is where you'll dispose of any items that have come in contact with chemotherapy. Next, attach the female closed system transfer device adapter to the saline flush and set aside. Do not let the end of the adapter or the flush touch anything but each other. If they do touch anything, use an alcohol swab to scrub the ends for 15 seconds. At the time you were told your infusion would be complete and the bulb appears completely empty or deflated, close the clamps on both the bulb tubing and your central line tubing. Call your infusion provider if the bulb still appears very full or feels heavy. Next, disconnect the tubing from the male closed system transfer device adapter by pressing in the tab with red lines on the male adapter and pulling straight out. Do not let the male adapter end that is still attached to your central line touch anything, but if it does, use an alcohol swab to scrub the ends of the adapter for 15 seconds. Now attach the saline syringe with the female adapter to the male adapter by matching up the red lines and pushing the two ends together. You should hear a click. Open the clamp on your central line tubing and flush the tubing using the push-pause method. Try to leave a small amount of fluid in the saline syringe. Remove the male adapter from the valve by twisting it off. Again, try not to let the valve touch anything, but if it does, scrub with an alcohol wipe for 15 seconds before attaching your heparin syringe. Attach the heparin syringe to the valve at the end of your central line's tubing and flush the tubing using the push-pause method. You can leave a small amount of fluid in the syringe. Remove the syringe, then close the clamp on your central line's tubing. If you have a port, now you can gently remove the dressing over the port needle. Stabilize the port by holding down the oval base of the needle with one hand. Then place your fingers of the other hand on either side of the handle in the middle of the needle and pull the handle back until you feel a firm stop. This means the needle is locked. Dispose of the entire needle tubing set by placing them into the chemotainer. If you have a PICC line or a tunneled central line, you will move right to this next step after removing the heparin syringe. Place the entire elastomeric bulb and tubing set into the chemotainer. Bundle up all the items in your work area and put them into the chemotainer, followed by your gloves. Be sure not to snap the lid down onto the chemotainer, as this will lock the chemotainer and you will not be able to use it again. Snap the lid down only when it's full. Wash your hands using soap and water, not just alcohol gel. Remember to bring your fanny pack to your next chemotherapy appointment. If you will not be having any more chemotherapy in the future, please call your home infusion company to pick up the chemotainer. If you have any concerns or questions, please call your home infusion company.